My name is Helen Stubbs. I'm from the Department for International Trade, the UK, based in Switzerland. And it's my pleasure to introduce Aahuti Rai, who is Chief Strategy and Growth Officer for Ampersand Health. And over to you, Aahuti, for a presentation of your award-winning company.
Thank you, Helen, and hi to everybody that's listening here today. I'm hoping you can see my screen. You should be seeing a blue slide with some visuals on it, and if you double-click that window, you should be able to see more of the slides, less of me, which is probably a better use of your screen space. And also just a reminder to post your Q&As on the cyberspace chat box, and we'll get to those in the last 5 minutes of this slot. So I am really pleased to be showcasing Ampersand Health here today. I've been with the company for about 6 months and had strong motivation for joining it because it is a social purpose company, one that's being founded by doctors and patients, and one that has pioneered a digital solution for the management of inflammatory conditions, which has also been scientifically validated. Also, a big bonus for me when I was deciding to join the company was really that the solutions have been co-developed, and they've been co-developed with patients and doctors and partners, CCUK, NRAS, some of the national partners that we have collaborated with, in conjunction with clinicians from King's College Hospital and Barts Health. So it's an absolute privilege to talk to you about our solution, which is a digital medicine for inflammatory conditions. I'm just going to check the chat because I know people sometimes post if they can't see the screen or whatever, but I'm not seeing any comments. So I'm assuming everyone can see what I'm seeing here on my screen with the slides. Okay, so I guess it really makes sense to start with why. And the 5 minutes that I have today, what I can do is share with you the headlines of the why, the how, and the what of our solution. Our reason for existence, our core mission, is really to improve the health and happiness and quality of life for patients that have inflammatory conditions, long-term inflammatory conditions. So conditions such as rheumatoid arthritis, dermatitis, inflammatory bowel disease. These are conditions which share common characteristics. So inflammatory conditions are characterized by unpredictable cycles of relapse and remission. And this makes disease state and severity of disease variable for each and every person. And in contrast to the unpredictable character of these conditions, the clinical pathways to help patients with these conditions tend to be fairly routine in nature. And we see sort of a 3-month cycle of routine appointments in which there's a whole host of very valuable treatment options. So whilst the goal of treatment for these kind of conditions was historically about managing symptoms, and is now with newer treatments really about ensuring that the disease doesn't progress, really what our solution is about is working in harmony with a clinical pathway and giving clinicians the ability to remotely manage the care of their patients, and also giving patients the ability to self-manage their own condition using a number of different interventions. So I guess if we think about our stakeholder environment and our solution and who are we really trying to help, we really have kind of 3 main stakeholder groups. We have our patients, we have our clinicians, and then we have our industry partners who are developing a lot of the biological medicines and treatments to help patients with these conditions. So as far as our patients are concerned, really the basis of our proposition here is really about education, engagement and empowerment. And I'll go on to the next slide in a moment, which talks a little bit more about how we go about doing that. For our clinicians, we have our Health Suite platform, and this really allows them to offer remote and personalised care to individual patients or cohorts of patients, depending on the stage of their disease, relapse, remission, the severity of their disease. They're able to do that level of cohorting to be able to tailor the pathway. And again, I'll speak a little bit more about that in a moment. And then I guess for our industry partners, it's really the value of our underlying data sets. What we managed to consolidate in the foundation of our solution is a number of different perspectives on the patient. So the patient health record is an absolute foundation to this. But on top of that, self-reported patient outcomes, contextual data, behavioural data, all when consolidated yield very powerful insights which really allow for the development of treatments to be more specifically targeted. So if I talk a little bit more about the specifics and really honing in on the specifics for patients, whilst the app that we have has like the basic functionality of symptom tracking and keeping track of blood test results and medications and appointments, what we really emphasize within our solution from a patient perspective is really giving them some education and empowerment and engaging them to manage their health proactively despite their condition. There is a growing body of evidence showing that managing disease influencers can have a really big impact on quality of life and the outcomes overall of the treatment that they're undergoing in the actual clinical pathway. And therefore, what we have invested a lot of our energy in is developing additional content and treatments to complement the clinical care that the patients are receiving. So we've developed, using behavioural and data science, we have developed programs which focus on medicines adherence, sleep improvement, managing stress, staying active, and soon to come will be more content around healthy relationships and food choices. So in developing these, we use very well-known established academic frameworks for behaviour change. And also we undertake regular studies and inclusion really of patient groups in designing the course content, engaging with them to really understand what's resonating, what's still difficult to understand, what's difficult to practice on a day-to-day basis. As far as our clinicians are concerned, there's a whole host of features, benefits and functionality, and some of that leans very much into a better quality of care for the patient, a more personalised care plan for the patient. But there's also a vast number of benefits, I guess, which lends themselves to the use of secondary care resources. So I guess in the limited time that I have, if I were to focus on the central benefit from a clinician perspective, it would be very much around the ability to cohort the patients, to really understand from a remote monitoring perspective what their symptoms are, what medications they're on, and outside of the 3-month routine appointment, really being able to offer them kind of personalised care and treatment. And this does result in efficiencies for secondary care resources, and an initial surveillance study has shown us some results around that, which I'm obviously happy to share as well. So being mindful of time, and I think I have pretty much run out of time, this wouldn't really be complete without a mention to our special co-founders. I know they wouldn't want me to spend too many valuable seconds and minutes to talk about them, but very much a business founded by clinicians and patient advocates alike. And in the chat, I will post some more information about the business, about our solution. And please feel free to offline contact me. My ask today is really just that we get a chance to continue the conversation. Thank you.
Many thanks, Aahuti. Thank you for that presentation. Very interesting.